today's topic is how food affects the mood. Okay. So we all know that there is a saying that अगर पेट खराब तो if पेट साफ तो सारे रोग माफ. हम ऐसा क्यों बोलते? Because all disease begins in gut. That was 2000 years ago, Hippocrates said. So even that time it was well known that gut health is very important. So I will be telling certain things about gut microbiome and how immune system is regulated by gut. Okay. Then what is the pathogenesis of dysbiosis? How gut health is getting affected by various influencers, because finally we have to rule out those triggers in our life. Then what is the role of diet? And then lately I will tell you how food affects mood and how even mood affects the food choices both together. And then what is lifestyle medicine? How we take one prescription in lifestyle about food, especially. What is the concept of lifestyle medicine? All that I will tell you. So first, understand the definition of gut health. Gut health is not about that you don't have acidity, constipation, diarrhea. That means you are okay. Gut health is basically a state of physical and mental well-being. So the definition itself says that mental well-being is also connected to gut health. In the absence of gastrointestinal complaints, without any risk of bowel disease, and without any absence of confirmed bowel disease. So what we focus normally as a gastroenterologist, okay, we have acidity, constipation, gallstone, pancreatitis, but nobody focuses that this person's mental health is not good. Probably we have to treat the gut. So now we have to think in that way instead of straight away sending them to psychiatrist. So why we say that all disease begins in gut? Because in humans, the gastrointestinal tract represents large microbial ecosystem where several trillions of microbial cells are there. If you see here the ratio of microorganisms and human cells, the microorganisms are higher than. So it is 100 to 200 times more than our own cells. So we have more microbial genetic content than our own human genetic content. That's why from localized GI disease to neurological, respiratory, metabolic, cardiac, all illnesses are connected to gut. If you see here in the metagenome shotgun sequences, they say almost double the metabolic pathways are governed in the gut. If you see 18,000 significant associations are there between fecal metabolites and the blood metabolite. Okay. So this is the data which says that gut microbiome is very important for each and every one of us. Now, if you see here, whatever diet we are going to take, it will actually affect the gut microbiota. And then that gut microbiota will produce lot of neurotransmitters, lot of cytokines, inflammatory pathways, immune regulations, and that will finally through various mechanisms will affect the brain. It will breach the blood-brain barrier. It will send the neurotransmitters like serotonin, dopamine, lot of things, and lot of inflammatory cytokines also. So that finally affects the mood also. So this is the circuit we have to balance. Now, if we see here, what type of food you eat will decide your mood. So if you are having too much of excess coffee, tea, caffeinated drink, that means you are making your pathway, your system stimulatory. You will be more anxious. If you are taking too much of refined sugars, you will have a lot of mood swings. Okay. Suddenly you will feel excited after sugar rush, and later on there will be a phase of depression because your bad bacteria will get over powered by easy sugars. And then if you are having too much of high fat, cheese, burger, pizza, pasta, then these things are depressive foods. Finally, because again, the gut microbiota will be changed. If you're going to have too much of non-vegetarian food, definitely that food itself comes from a negative energy. You are killing someone, so there are a lot of release of negative vibes in the universe. So that food, whatever they say it is healthy, now research is saying non-veg not even a good protein also. People think non-veg is a very good protein they eat. They don't even think of energy of food, but whatever you take, whether it is energy, whether the way it has been created, and the kind of chemicals it is releasing in the body, I will tell you in future slides. So definitely it affects. But if you are going to, I always say, if you are eating too much of sugars, fatty, fried food, then you are going to be depressed. So I always ask, did you eat ice cream? Did you eat out? Whenever a patient comes with any, so before the onset of illness, what he ate, that decides that why he had the problem. So any person, I think we all should ask whether we have an healthy GI system, because we have understood quite well that gut health is important. So your nutritional status should be proper. Okay, you should have regular bowel movement. There should not be any acid reflux, nausea, vomiting, diarrhea. All that is easy to ask. There should not be any enzyme deficiencies, any milk intolerance, wheat intolerance. Those things are also important. Then stable intestinal microbiota. Now this is something which is hidden. We don't know. So we have to go with very subtle markers like bacterial overgrowth. We have a breath test where we can check the bacterial overgrowth of the gut. Then we can do a gut microbiome analysis in stool. And then we have to see whether stool consistency is normal. All that tells us that how healthy gut microbiome we have. Then our immune system. If somebody is getting recurrent cough, cold, allergies, autoimmunities, that means the gut is affected. So here, effective GI barrier. If you have a GI barrier intact, no allergens, no toxins will cross it. Less allergies, less autoimmunity. But if you have a leaky gut, you are going to cross everything to the blood, and then a lot of reactions will come. And then finally, the status of well-being. So you have to have a, because of balanced serotonin productions and enteric nervous system, both work hand in hand. So the moment we have a anxiety or exam, we have a gastric hurrying, because enteric nervous system is getting affected. So this is how we should assess the GI system. And we all know that host immune response, pathogen overgrowth, then intestinal endocrine functions, neurological signaling, bone density, energy biogenesis, 10% of total happens in gut, and a lot of neurotransmitters. So this is how the brain and the mood also will get affected. So, and it is very important for eliminating toxins also. So when we are going to have a dysbiotic gut, we are going to have all kinds of diseases you can see on the right side. And then if you see here, 1 second, yeah. You can have liver disease, obesity, diabetes, cancer, nowadays all lifestyle diseases. So again, you see here, the homeostasis is disturbed by unhealthy diet, unhealthy lifestyle, lack of sleep and stress. But if you eat a lot of fruits, vegetables, vitamins, you are going to maintain this homeostasis. So this leaky gut example, can you see here that there are this side there's normal tight junction, and here between cells there is leak, and all these will produce inflammation, autoimmunity. It will go and breach the blood-brain barrier. And we have different microbiota, not only in the gut, in oral cavity, in skin and respiratory tract, everywhere. Okay. So basically, if the gut is out of whack, the immune system will start become confused. And that's where we start all kinds of recurrent infections, allergies, and how it happens. If you see the gut epithelium, there are various cells. You have enterocytes, which mainly works at intestinal barrier. Then we have local pairs patches for immune detection. Then we have different cells for identifying microbial antigens. And then Paneth cells, which will produce antimicrobial compounds. So you can see layer by layer, lot of cells are here, which actually governs the entire uh, whatever from environment we are taking in, how it is going to interact with the human body. That all gets decided in that gut lining, because we are eating it or we are drinking, and then things are going in. So if the positive mental health is affected by the moment you take good food like fruits, vegetables, legumes, seeds, pulses, plant-based diet, it will create a lot of anti-inflammatory compounds, omega-3 rich food, low-fat diet, low carbohydrate diet. What it does is, you can see here, that it will increase certain beneficial bacteria like bacteroids, Prevotella, short chain fatty acids will be produced. Okay. And interleukin-10. So anti-inflammatory cytokines will be more, and the harmful bacteria will be less. And lot of here you can see the cytokines and anti-inflammatory compounds that will be less. CRP will be less, lipopolysaccharides will be less. So all this will change the neurotransmitter composition, brain gut connection through vagal nerves, and enteric nervous system connection. So all this will affect. If you have bad food like all these junk food, again your ratio bacterial dysbiosis will be more trimethyl amine oxidase. This TMAO is mainly produced by non-veg food and egg, and it increases chances of heart disease. Okay, this TMAO. So all these will change, and too much of inflammation and poor mental health. So excessive immune response, autoimmunity, I've already shown here how T regulatory cell, T cell mediated pathways of entire immune system is governed by gut. Now, what are the influences on the gut? How baby is delivered, whether baby was breastfed, what diet it was given, how many times of antibiotics you have taken, how many infections you had, what is your diurnal rhythm, whether you're sleeping on time or not, what kind of microbial exposures you have, and all this will affect the gut microbiome and the future diseases. Okay. Even risk factors for childhood diseases and obesity also happens because of bad gut. So you can see, and then finally you may develop a GI disease, or you may develop some extra GI diseases. And here if you
Dr.
see,
Priyanka, can you go to the previous slide, please?
yes.
And can you just elaborate that the points of how the mode of delivery affected our gut health, how the mode of the genetic features, how
So mode of
the
delivery
infection
basically,
antibiotics?
if you have a vaginal delivery, you have a good bacteria in the neonate GI tract. If you are going to have a cesarean, because the natural process will not happen, so the colonization of the infant's mouth and gut will be different. Then, so definitely vaginal delivery is good. Then host genetic features means they have certain genetic tendencies through genes. Okay. So that will also decide their further gut microbiome status. But normally genetics is not directly related to gut microbiome, is the epigenetics. And epigenetics is there are certain changes around DNA which happens by lifestyle change like diet, physical activity, stress, exercise. So that affects the DNA as histone acylation, methylation, that is called epigenetic. That also affect the gut microbiome, and gut microbiome finally changes the DNA by doing the epigenetic changes.
So you
So
want to say that more than genetics, it's a epigenetics which is deciding our gut health and our
yes,
immunity and our lifestyle.
yes, and the gut health actually decides the epigenetics, and epigenetics is decided by the lifestyle. And 70 to 90% of the transformation in the family runs through epigenetic change. The 10% only the real genetic works. I'll
Great.
show you that another slide. There are a lot of slides, so I'll show you that also. So now if you do various disease association, here if you see, if we take nowadays, a lot of people are saying we are having fatty liver, and people say I am having fatty liver and this is normal fatty liver. Fatty liver is never normal. It can go to cirrhosis. I am a pediatric liver transplant physician. I am seeing a lot of liver cirrhosis just because of excess food. Okay. And they are landing up in the liver transplant, just because of lifestyle. So here you see the dysbiosis produces all these bad metabolites, lipopolysaccharides, TMA, then conjugated bile acid, short chain fatty acids. All these will produce endotoxinemia, fat accumulation, more oxidative stress, more liver injury to liver, and insulin resistance, more diabetes, more metabolic syndrome. So everything again starts from dysbiosis. Here, if you see nowadays, a lot of female have PCODs, obesity because of excess. This food industry, everywhere we only eating junk food, too much of gut inflammation and insulin resistance, then leaky gut, then you can see various effects here because of gut. So, and definitely bad mood will be there. So here even genetics is involved in progression of fatty liver disease. Some of the fatty liver will be normal, some will have a problem. So genetics is also involved, but associated weight and their diet all together will affect the entire metabolic spectrum. If we see neurodegeneration, there are a lot of studies that potential role of gut microbiota in Alzheimer's disease. Okay, they have seen the modulation of these neurotransmitters like serotonin and acetylcholine by microbiota. Okay, so there are various studies. There is a low grade immune activation which happens in the gut, which finally decides the neurodegeneration in the old age. That how many people, so if we take our gut better now, if we are going to live up to 80s, I think we will be off Alzheimer's disease. But today's gut health is bad, then the chances of in future of developing Parkinson's, Alzheimer's are more. Okay, because of a set low grade inflammation which affects the brain. So there was a double randomized trial. They gave milk versus probiotic, and they found mini mental state exam score improved after probiotics. Okay, so that means you only, what did they change? They improved the gut health, and they found that their mental state examination was better, and the CRP, triglycerides, insulin sensitivity also better. So again, then there was one more study on Alzheimer's disease, effect of grapes and red wine with polyphenols. So here if you see, all these will actually changing the gut bacteria and the pro-inflammatory markers, and that's how they stop or prevent the Alzheimer's disease progression. Here you see, if you are going to have more dietary fiber intake, then you have good short chain fatty acid production, more mucus production, less pathogen, good anti-inflammatory related metabolites in signaling in the brain, less Alzheimer's disease, good functional brain. But if you're going to have bad food, it all will it will go into the pro-inflammatory state. There is
Dr.
one more
Priyanka,
study.
one question has come. If you allow, we can take this question at
Yeah.
this point. So the question is this, that we are talking about the probiotics, right? What kind of probiotics we should take or we can take in our regular diet? And one more question has come, that is that if we are having a bad gut microbes, and how to change that bad gut microbes into good gut microbes in a short period of time. So if you can also
Yeah,
answer
so
this thing here.
as I told you that it is basically lifestyle change. So I am going to tell in the future slides that if you are going to have balanced food, fruits, vegetables, and legumes, seeds, nuts, you are going to give a good food to the good bacteria. So that will change your gut. Then you can take probiotic supplements, but probiotic supplements, taking only probiotic supplements is not going to change the gut. It's basically the entire good food habit will change the gut microbiome, which I will tell you in later slides.
So you
What
want
were
to
the
say that if you're taking just probiotic from outside, it will not affect at all. We have to change our lifestyle, what we are eating every day, the
Yes,
fruits,
yes.
vegetables, and other things.
Because prebiotic, no, the those good bacteria which you will feed inside, they need good food. They need good prebiotics on which these good bacteria will grow. So if you are not going to give them the good soil of prebiotic by having good food, whatever supplements you take, it will not last for long.
Thank
Okay.
you.
So supplements are required if you are on antibiotic. I will let you know that also. So here you see one more study where the role of gut microbiome in the psychiatric disorders. So I'm sharing all the slides with different brain disorders here because it was mainly on the mood. So we have to basically maintain the bacterial diversity. There are various kinds of bacteria, fungi, parasites, viruses, mainly bacteria. So there is a proper ratio of each bacteria. And that ratio and diversity, if you are not maintaining by having various fruits and vegetables, then the monotonous bacteria will be there and the entire dysbiosis process will start. So I am telling certain gastrointestinal cases. Why? Because just to you people should know how we, treat the GI disease and how we whenever anyone is coming to any of you, you should know if the gut, if they are not suffering from GI disease, because that will make leaky gut. And then your whatever treatment we are giving, that will not be affected, will not be effective. So here there was a 10-year-old child. He had a lot of pain, severe pain, but we did all the blood investigation. Everything came normal. CBC, LFT, RFT. On examination, no tenderness. CT scan, initially mild thickening, but that also became normal in repeat ultrasound. Repeated antibiotics, repeated antispasmodic. Then they labeled him as a functional pain abdomen. So, and one of the centers said we will not do the endoscopy, it's not required. But I did endoscopy. Now, if you see here in intestines, this is the small intestine, this is duodenum, if you can see, and the upper part is the stomach, this is fundus. So you can see here redness near the endoscope here, and you can see these small nodules. These are the duodenal nodularity. Now, this tells me that probably child may be having some food allergy. Okay. You can see these white nodules. This is a lymphonodular hyperplasia which happens. In endoscopy, I see. And the report came non-specific duodenitis. Now I did food allergy test, and you can see a lot of foods are positive here. I do by myself. I do skin prick testings and I see what food baby is reactive. I eliminated all food initially and he became all right. So what we did, we eliminated the trigger. I didn't give any antibiotic or steroid or any other thing. It was just finding the root cause, and they labeled him as a functional. So never label anyone as functional, because there is some trigger to each and every patient, I feel.
Dr. Priyanka, can I stop you here and ask one question? Because
Yeah.
many of the audience is non-medical, and this is a very good case study you just have discussed with us. Because being a doctor, I could understand, I know these kind of things. So that the child of 11 years old was admitted in 3 hospitals and he was not treated. And luckily he got you and he was treated. We had done the allergen test. So we just want
Yeah.
for our audience that it's not always a disease when it's a functional level or functional, and no doctor is treating it.
Yeah.
They're giving the antibiotics and they're making the things more difficult for the kid because they're working killing all the microbes also. We just want a
Yeah.
little bit more light from you so that for audience they can understand this thing in a
So,
simple.
so definitely, you normally what we do, we go to some physician. They will say, okay, it may be infection, take antibiotic. But what we feel like, if there is fever, if in the blood test some inflammatory markers are positive, then only we give antibiotic. Every case doesn't require antibiotic, because antibiotic will kill normal bacteria. Okay, and then you will have bad bacterial growth, and that bad bacteria will then change a lot of other metabolic pathways in the gut. So never ever, always try to think, always choose medical professionals. Try to, if they are advising you certain investigation, please do them. Don't say no, just give me some medication. Because why they are writing investigation? To actually find out the exact cause and treat it, not blindly write antibiotic in each and every case. Okay.
Thank you. Thank you.
So here we have food allergy test also. Especially I showed this slide because this nobody does, and people should know that, even we can check the food triggers. Now there was a girl with lot of nausea, no other history, only nausea. She went to many pediatricians. No, and everybody was like, we have given all antacids. Nowadays there is a very common thing, just take some antacid. Acidity is there, take antacid. I am having gas, take antacid. No. Why you are having gas? Why you are having acidity? Why there is nausea? Something is abnormal. Don't try to go to over-the-counter medicines and take these antacids, because you are going to suppress your acidity, and what will happen in future? You are affecting your immune system. After some 2-3 years, you will start having bloating or repeated infections or allergies. So try to find out the cause. So here uh, her all other workup was negative, and I did the IG level because she came after maybe 10 doctors, so it was 3000. Then I did skin allergy test, and she was severely allergic to eggs, and every day her mother was thinking boiled egg is very good, and she was giving every day. And finally, she was allergic. So I eliminated that and her nausea got. So I'm not giving any medication here. And patients are getting fine because what we are doing, we are actually eliminating the trigger which caused this particular symptom. Now, another case. Now, here what's happening? Repeated vomiting, repeated diarrhea, repeated antibiotics, repeated admissions. And patient was on steroids. So, patient was immunosuppressed also. So, because of that, the fecal calprotectin, there is a test in stool which will tell me indirectly that there is an intestinal inflammation. I did that. And I did the biopsy. Now, biopsy showed some microorganisms. So, initially, this case where if you see calprotectin is high, so there is intestinal inflammation. Now, when biopsy I did, there is a some particular change related to gluten sensitivity. So the moment I stopped wheat, gehu I stopped, gehu, suji, maida, child became normal. Okay. So there are a lot of triggers in the gut. It's not that I will be treating with antibiotic, I will stop milk. So there is something called non-celiac gluten enteropathy. So this was the case. Another case, patient is having kidney disease, patient is on steroid, repeated diarrhea. Now, if someone is on steroid with nephrotic syndrome, that person's immunity is less. So he will develop atypical infections. I did endoscopy. That patient was living in a chawl. So he was having a common toilet. We found a very atypical parasite here, Isospora belli. Only 14 days of Septran course, he became fine. And he was suffering for 2 years, repeated diarrheas. But only one, the moment we found out that this is the cause, we treated in 10 days and he was fine. So again, you have to find out the cause. What is the cause in particular patients? Okay. So that was certain glimpse of GI cases. Now, what is lifestyle medicine? Lifestyle medicine is basically we have to apply to treat any chronic disease, for mental health also, for gut health also. You had a question that how to fix up gut health. So this is the answer. By applying lifestyle medicine approach, you are going to maintain good gut health. So we have 6 pillars here. Like you have to work on your nutrition. There are 6 pillars of lifestyle medicine: nutrition, exercise, stress management, social connections. You should have good family, friends, sleep, and avoid substance abuse like alcohol and smoking. These are the 6 pillars of lifestyle medicine. And this will change 70% of lifestyle diseases. Okay. So if you change the good diet, here you can see how different bacteria are having different effect by different diet, high fat diet, more non-vegetarian diet, or high fiber diet. And you see effect on central nervous system. If you take this kind of diet, it is inflammatory, more thrombosis, more chances of stroke or block. But if you have high fiber diet, it is anti-anxiety and anti-inflammatory. So if you see, if you're taking too much of maida, too much of milk, too much of refined sugar, you will make inflamed gut, bad bacteria. But if you take a lot of fruits, vegetables, a lot of foods containing prebiotic, then you see plus probiotic, which I was explaining you, plus probiotic makes your gut healthy, not only just probiotic supplement. The prebiotic comes from the food like minerals, vitamins, polyphenols, flavonoids, glutamine. These are prebiotics. They come from food, healthy food, which I'll tell you what is healthy food. So we have a bidirectional brain-gut axis. So everything will be affected here if what you are eating. So these are the prebiotic food: banana, barley, garlic, different roots, onion, oats. These are the prebiotic food. So good bacteria will eat this in the gut. So what is epigenetics? I was telling you. So in DNA, we have a lot of extra changes. Okay. And these are affected by food, physical activity, smoking, alcohol, pollutants, stress, shift work, aging. All this affect this epigenetic change. And finally, our genetics also gets changed. Okay. So your genes are not your destiny. Your lifestyle is your destiny. So change you make today in your lifestyle will make your change in the future. And what are the key influencers of this epigenetic change? It's diet, exercise, sleep, and obesity. So now very important slide here for doctors especially and who are non-doctors, that there is a, whenever a patient comes to you or you are going to a doctor, please ask the question whether you are ready to change first, whether you are not want to change, whether you don't know why you should change, or whether you know that we have certain risk factors. If we don't change, our we are going to get a lot of diseases. Then we have a stage where we are already acting, but we want to improve little bit. So in lifestyle medicine, first we assess the patient. That patient is in pre-contemplation phase, just thinking, or contemplation phase, or actually started reading on health and wellness, started changing slow changes in his diet or exercise. And certain patients are in action phase, already doing it, but they lost the track. Maintenance phase is where you are having adequate diet, regular exercise, adequate sleep, on time sleep, and that is he's maintaining for more than 6 months. Otherwise, patient is not in maintenance phase. So these are the trans theoretical stages of change. Now, in lifestyle medicine, what is different that we do health coaching. If a patient comes, I don't write a prescription. I coach. I first make them aware. I motivate them according to their what stage they are in, and then from there, one by one, there is the journey start for maybe 1 year, 2 year. Then they have a, if they are diabetic, their diabetes reversal happens. If they are overweight, slowly they start losing weight. They change their physical activity, nutrition, they change healthy habits. So health coaching changes a lot. It requires a lot of time with the patient also. Now, role of diet. Mediterranean diet has more fruits, vegetables, salads, soups, legumes, pulses. And this Western diet, if you see, it's mostly maida, cheese, non-veg, processed food. So Western diet will cause chronic disease and dysbiosis, and healthy diet, which I will tell you again. Now, there are a lot of studies that how, here you can see we have to maintain this bacterial diversity. Okay. And for that, we need polyphenols, flavonoids, vitamin A, which will promote more beneficial bacteria. But if you take bad saturated fat, lard fat, you will promote bad bacteria. And when this balance goes out, we don't maintain the diversity, and we get a lot of diseases like obesity, heart disease, diabetes, allergy, and a lot more. This is one more study which tells if you are more vegetarian, you have more good bacteria and good metabolites. If you are omnivore means if you are on non-vegetarian diet most of the time, you have more bad bacteria. Okay. Now we have an assessment in lifestyle medicine. How we
Dr.
assess?
Priyanka, can I share something here?
Hmm.
So there is a channel, Lalan Talk. On that channel, there was a hepatologist who has done recent interview like 3 months back. He discussed that and he told that this non-veg food is good for health. If someone is taking only vegetarian food, that means they can suffer from lot of diseases because of B12 deficiency and other kind of things. So, and people are watching this. I'm just sharing this thing because people are watching this kind of program, and by that, they're not promoting the health kind of system. What we are doing on this channel, we are promoting this vegetarian diet. We're promoting gut health like this, and we're doing a lot of things, meditation and other kind of things. So I just want a few words from the experts to counter that thing. That because that video has been shared a million times, watched a million times. So what is your take on that?
Even because I am an LM physician, I have little path on meditation and wellness. I am able to understand the energy of food. But rest of the medical fraternity still thinks that non-veg food is healthy actually. And they eat non-veg being a doctor because we have not been taught in MBBS of, these components in a detailed way, I would say. And they think that non-veg has good iron, good only vegetarian has to take vitamin D3 extra and vitamin B12. Rest all you don't need to take. Rest all good effects. So there is, you can supplement yourself with B12, D3. But if you take non-veg, everything bad, more cancerous, more inflammatory, more fatty liver, more diabetes. And this is, I am talking as an expert, as a allopath expert, as a gastroenterologist. There is a lot of evidence now So even if you're thinking, if somebody is telling you non-veg food is good, I am telling you with full research and as a lifestyle medicine physician, and this lifestyle medicine course is from American board. So even now America is not promoting non-veg and Western diet. Okay. So
And they are also
don't
promoting the
go
Mediterranean
into
diet.
that phase that non-veg is good.
Right. Thank you. Thank you. So we have to counter these kind of things with the positive things which are real and scientific based, not on the base of the market and the needs of the
Yes.
market. So
Yes.
thank you. Thank you. Thank you.
So if I'm going overboard, I will stop the talk. You let me know because I had a lot of slides and I was explaining. You want me to
For,
continue?
for 5 minutes, we can continue.
Okay. So there are some,
After
so I will
Q&A.
rush little slides. So there's a basic nutrition assessment which you should have, like an entire nutrition panel apart from the, you have to ask the diet history in detail, what patient is eating. That will tell me a lot of things that, okay, I need to change how much. So assessment is very important. There are some over consumed food, like we eat a lot of added sugar, cholesterol, fat. You can see the picture here. And there are under consumed food. We don't take calcium, fiber rich food, magnesium, potassium because we don't take proper fruit servings. We take lot of 70% of added salt is from outside food. So if we stop outside food, we actually come into recommended sodium intake. And if for sugar, ideally less than 6 teaspoon for everyone. Ideal is you should not have any sugar. Now we are vegan to omnivore. Try to be more plant based, less non-veg based, because even non-veg protein causes poor bone health also. And you can see the effects of vegetarian diet here. A lot of good effects of vegetarian. If you compare cholesterol, for vegans it is 70, for non-vegetarian it is 120. So these are all studies. Now what is the foundation diet? How we should have? Our diet should have vegetables, fruits, legumes, whole grains, nuts, seeds, fiber, everyday diet. How you can make it? There is an SCLM plate. Your half of the plate should contain fruits and vegetables. Then 1/4 should be plant proteins and 1/4 should be whole grains. Then drinking water and little bit of herbs and spice. This is called a proper food plate which you should eat, not like just having 4 5 rotis and little sabji. Okay, so daily recommended fiber should be adequate because fiber, and we there is a something called nutrition prescription. You have to write in a specific way how much you want to give, what is the measurement, 1 cup brown rice 3 times a week in night, like that we have to write a prescription of nutrition. And never do microwaving, air frying, broiling, grilling. These are bad cooking method. Slow cooking, boiling and steaming is good because they have less advanced glycation products. Whatever now I'm telling is basically changing your gut health by changing these cooking methods. Add millets to your diet because millet changes a lot of things. We have kodo millet, pearl millet, foxtail millets, make millet dosa, millet idlis. They changes gut. And now there are a lot of studies that it decreases colitis also. Okay. Now, so diet actually changes gut microbiome. There are a lot of studies here, and you can see. Then we have a lot of these food additives. This please listen carefully. Food additives are not good. Whatever chemicals, these packet masalas, food adulteration going on. On fruits, there is a wax layer. In milk, there is pesticides. In wheat, there is natural pesticides. So these also changes the gut. So I always say, please avoid all packet food because at least some additives, some chemicals will be less in your diet. There are a lot of studies how emulsifiers, thickening agents, artificial sweeteners changes the gut. Okay. And then digestive consequences of chronic stress. If you're going to have too much of stress, it will also affect your gut health. You'll have more IBS, allergies, leaky gut, altered gut microbiome by this bidirectional gut flow. So how to improve gut-brain connection? Seal your gut by having good food, elimination diet, gluten-free diet, cook your food, eat fermented food, more fiber, apply those principles of nutrition. So you should have 5 servings of fruits and vegetables plus legumes, grains and nuts and seeds, and everything you have to have. Please be aware of adulterations. Nowadays, a lot of adulterations is going on. You can check with some test. And what is the good food for good mood? It is white. So we have lot of beans, you can see here. So the kind of plate I was sharing, that will make changes on your mood. So in my last slide, gut microbiome plays central role in overall health, and the microbial genetic content is 200 times superior. And we have 70% of immune system lies in gut. So plant-based diet is very good for all human health, and nutritional deficiencies and gut health will affect the mental health and cognition. So we have to improve both by changing the food. So your diet is a bank account. Good food choices are good investment actually. Thank you.